Hello, my name is Ophelia Stewart, and I'm a student at William Carey University in Hattiesburg, Mississippi. The goal of this video is to demonstrate the proper insertion of a Foley catheter. Three objectives I want to accomplish after the viewing of this video is: 1. The students will be able to return demonstration on the proper insertion of a Foley catheter. 2. The students will be able to identify the CDC guidelines for appropriate indication of a catheter use. And 3, the students will be able to identify preventions of a catheter-associated urinary tract infection.
Hi, my name is Coleman. I am also a student at William Carey University. I am here to do a teacher strategy on a demonstration of a urinary Foley catheter on a male patient. In a hospital setting, you would like to first check your physician's orders to do an indication of appropriate indication for a Foley catheter for the patient, as well as check the patient name and identity to make sure you have the right patient. And then afterwards, you want to make sure you have all your supplies at the bedside. Make sure that your bed is at waist high. Now, so we're going to get started. I want to make sure, in substitution of washing my hand, I'm going to do a hand sanitizer. Make sure that you use proper hand hygiene. I'm going to rub my hand until it's continued dry. And I'm going to don my hands with a pair of clean gloves. And at the bedside, I have a Foley catheter kit. Now, I want to open up my package. I want to make sure that this is just my area that I'm going to utilize for this procedure. And during the procedure, you'll see me talking to my patient, just basically letting them know to feel a little comfortable and kind of just talking my way through it. I have a garbage at my side, so I'm going to empty any kind of trash you may see me doing. This is important just to keep for later on in the procedure. I'll tell you about it. What is a proper labeling for the chart as well as the tubing for the Foley catheter. Okay, starting now, I want to make sure I open the kit away from me. So I want to turn it around. And I just want my sterile field. Keep in mind it will have a 1-inch border, which is like a contamination. So I want to keep that part in mind. I want to open up the kit away from me, and to prevent crossing over, okay. This here is the sheet that I'm going to drape with the patient. I want to make sure that I use the shiny side down. That's going to go down. And my patient kind of lift up a little bit the bottom. And I want to slide this under him. Okay. Once we're done, I'm going to lift this up and place this here. And I want to kind of keep privacy and keep my patient covered up. Now, I have the soap towelettes that we're going to use just to clean like the urethra opening and clean around the skin of the penis. There's 3 towels in here. I like to go ahead and take all 3 of mine out. You want to just do this just to clean the area just before you get started. Okay, I'm going to uncover my patient. That's the first one. I want to take his penis. I'm going to start with the inner and work myself outer using like a ring. Start here. Last one. Okay. Now, I'm going to take my hands that are considered dirty now. So I'm going to make sure I undone my gloves. Like that. Now, I have some antiseptic gel hand sanitizer. I want to open it. And sanitize my hands prior to putting on my sterile gloves. I have my gloves. And don my sterile gloves using my I feel like I'm going to. Okay, now I have a drape and I'm going to use now. I have my betadine. I want to open it, dispose of it. Go ahead and pull these 3 out. I have my lubricant, which I'm going to squirt in the tray. Okay. Now, with the Foley catheter, you want to make sure that you're careful with the tubing. It is real flexible, so I want to just make sure that I do not contaminate my catheter. I want to attach my 10 cc of water to the tube, and there's no need to blow it up to inflate it to see if it's good or not, the tubing. Now I'm going to take the tubing, and now I'm going to let my patient know that the betadine may be a little cool because we're at room temperature, and I want to make sure that my hand will become dirty because I'm going to use my left hand to hold his penis. I'm going to wrap my pinky around my thumb, and now I want to take the betadine swab and I want to clean the urethra opening, and I want to do like a circle of rings around and to clean the whole head. And start here. Okay, the third one. Dispose of. Now, I want to take my Foley catheter. I want to lubricate it with the lubricant. I want to go in, and like I said, I would tell my patient, you know, just take a deep breath. Okay. And you want to keep on unless you meet some resistance. But now that I see some urine flow, I want to go an extra inch. Okay. Now, at this point, I will inflate it with 10 cc cc of normal saline. I'm going to pull back on it just to get the resistance. And that there is a insertion of a Foley. Now I want to let my patient know that I have a Foley stabilizer stat lock that I want to use and put on his inner thigh. Because this is not a sterile technique, I want to just advise the patient, let him know if he has a favorite side, I will either put it on either side of his inner thigh. I want to make sure it comes with 2 skin protective pads. I want to make sure that I wipe the inner thigh with it. Skin protective prep is dried. You want to go to do a location and place it. You want to make sure that you have enough room with the Foley catheter. You want to place it on the inner thigh, more towards the left, closer. Now I want to remove this. Once it's placed and once it's secure, you want to go in, you want to lock down the foley. Okay, and it's locked in place. I want to make sure that the foley, this here is a bed clip. You want to attach it to the sheet to eliminate loops in your foley to help it flow better. And you want to make sure you attach the foley catheter to the at the foot of the bed. And this is part of the documentation of a foley catheter and placement. I want to make sure that I do a date, time of the insertion, and my initials as the RN. I want to do it for the chart as well as for the drainage tube. So I want to make sure I do my date for today and initial it. And for the chart, I'm going to place this in the progress notes, or based off of what facility you're at, try to find out whether there are protocols as far as documentation of a foley. Some are electronic as well as paper charting as well. And on here for the tubing, make sure that it's dated, time, and my initials. This will conclude my demonstration of a urinary foley catheter insertion for a male patient.
Thank you for watching our video on the proper insertion of a foley catheter. A few key points that I would like to add is a foley catheter should only be inserted when necessary and removed as soon as possible. A few ways that we can help prevent catheter-associated urinary tract infections, also called CAUTIs, is ask your health care provider each day if the catheter is still needed. Make sure your catheter tubing is secured to the patient's leg or abdomen if possible. Make sure all hospital personnel wash or sanitize their hand before or after handling the catheter. Do not tug, pull, or twist the catheter tubing. Always keep your urine drain bag off of the floor and avoid disconnecting the catheter from the drain tube. The CDC has 6 guidelines for indication of whether a catheter should be inserted, and these guidelines should be reviewed with your healthcare provider before insertion. One is if the patient has an acute urinary retention or bladder outlet obstruction, the need for accurate intake and output measurements, used for any selective surgical procedures to assist in healing of an opened sacral or peritoneal wound, patients requiring prolonged immobilization, and to improve comfort for end of life. Thank you again for watching our video. We hope you enjoyed it.